Abortion providers think that the regulations brought on by the coronavirus that hospitals have to abide by do not apply to them. They continue to provide abortions even though they should not. First, there are plenty of medical procedures right now that are being postponed because of the coronavirus epidemic. People want to make sure that hospitals and doctors have the proper equipment to deal with those who actually need it and not for things that aren't necessary. For example, this article tells us that things like pap smears, mammograms, and pelvic exams, which some view as essential for women's healthcare, are being postponed because of the coronavirus. Doctors and hospitals just can't do everything at once, and so they need to prioritize. Abortions, however, continue. We see here from BuzzFeed that abortion clinics are staying open. And the reasoning is actually pretty poor. It's because these abortion clinics believe that, quote, pregnancy-related care, especially abortion care, is essential and life-affirming. How backwards do you have to be to think that abortion, which literally ends a human life, is somehow life-affirming? It's the exact opposite of that. But abortions are still being performed even though they shouldn't be. We have another article from Huffington Post where they're basically whining that the coronavirus is making it harder for women to get abortions because abortion access is under threat. And they argue that the coronavirus could cripple abortion services. A spokesperson for one of these abortion clinics said that they are concerned about a shortage of medical supplies like gloves and masks. We worry that all healthcare resources are being channeled to non-elective procedures, and abortion tends to be classified as an elective procedure. You have abortion providers who are basically complaining they don't have enough gloves and they don't have enough masks, and they're worried that all of those are going to non-elective procedures. Non-elective being things that will save people's lives, and they're complaining they don't have enough to perform abortions? Even when states demand these clinics close temporarily, they don't. For example, Texas and Ohio have included abortion among non-essential surgeries and medical procedures, meaning that they need to be delayed, again, to make room for more coronavirus patients, which just makes sense. And they say they're trying to preserve critical medical equipment at a time when the country's health infrastructure is in danger of being overwhelmed. These states are basically saying if you don't need to perform these sorts of services, you shouldn't be doing them because they need all of the equipment for coronavirus right now. And that's a really big deal. And yet, as we see here, the state's abortion clinics remain open. They think they are above the law. They think they're important enough that they can continue to perform abortions even when all of this is going on. And if you don't think there's a shortage of medical equipment, think again. There's a health center in St. Paul, Minnesota, and it's considering shutting down because it doesn't have enough equipment for the doctors. Doctors have said all around the United States that they have a dire shortage of masks, surgical gowns, and eye gear. And yet at the same time, doctors are saying they need all of this to deal with the coronavirus outbreak. Planned Parenthood has the audacity to try and beg people to donate hand sanitizer and masks and all of this personal protective equipment that doctors desperately need. So they are taking away the supply from hospitals and doctors that need them so that they continue to perform abortions. Now, maybe you think it's not just about abortions, about all the other things they do. Looking specifically at this organization, Planned Parenthood Keystone, who is requesting all these donations, they posted just a few days ago on their Facebook this, where they said that at this time, Planned Parenthood Keystone is serving patients for abortion services only. So they're not doing anything else. They're not even giving out birth control or ultrasounds, pregnancy tests, nothing. They're only doing abortion services at these locations, and yet they're asking for medical equipment that doctors desperately need. If that's not an example of someone who's full of it, I don't know what is. As of the time of this recording, there are 83,000 confirmed cases of the coronavirus in the United States and 1,200 deaths. It's threatening something like 37 million jobs. The unemployment rate could skyrocket, and our GDP could decrease by something like 24%. And yet, pro-choicers are worried in all of this about abortion, because that's basically how they act. Slate said that abortion care is essential healthcare, and that is complete nonsense. Essential healthcare or an essential surgery procedure is something that, if delayed, may result in a patient's death or permanent impairment. It is very, very, very unlikely that someone not getting an elective abortion is going to somehow die because they didn't get it. As a matter of fact, delaying the abortion is what's going to save a life, the life of the child, because the fetus is in fact a human life. So if anything, not having an abortion would be an essential component of healthcare. But all of these people don't really seem to care about any of this. They just want abortions to continue because that's who they are. Going back to this article from Slate, I would take anything Slate says generally with a grain of salt, this one specifically, because it also linked me on Slate to this article right here, where the title basically says everything. Do I need to stop sleeping with new guys because of the coronavirus? It's a woman asking or basically complaining that she's afraid her sex life is going to be ruined because of the coronavirus, and that she's been on 3 dates this week and she's afraid she won't be able to make out and have sex with new people because of this. If your priorities and your concerns during this epidemic right now are that abortions are threatened and that you might not be able to sleep with the third guy of the week, you need new priorities. But as we saw, abortion providers don't really seem to care about any of this or about the real impact of the coronavirus. They only care that it impacts their ability to provide abortions. Let me know what you think about this down in the comment section below. And if you appreciated this video or any of the other videos that I've created, leave a like and a comment, and maybe share it with someone you also think might like it. As always, thank you for watching, and I'll see you next time.